you.
Bop, bop, beep, bop, bop.
Hello!
Hey,
Welcome back to another episode of Beaker Bros.
I am Sohnia.
And I'm Jaanuni.
Jaanuni, it has been too long. It's been
Too long!
It's been too long. I don't know the last time we actually made an episode. The last one that we posted was...
It was not even done by us. It was done by our research coordinators. And then a podcast that we probably recorded and released was back in February.
No, wait, the ones that I did, like, even the last ones, those were with, like, the guest hosts, Caitlin
Yeah. So it's been a while since we've done a podcast together.
Hey, man.
How's it going? Little updates, life updates. Let's, quick 1 minute spiel. Go.
Still in grad school.
Woohoo!
Work is going well with that.
Love it.
Life is good.
Great.
Going to a couple concerts in a couple weeks. That's
Okay.
exciting.
Okay.
Things are moving. That's about it.
Love it. Went on exchange, came back,
Yeah.
graduated from my master's.
Right on.
Graduation is in 2 weeks,
Heck yeah.
and I'm working
You
right
should
now.
vlog that.
My graduation?
Yeah.
Hi guys, welcome to my graduation. Sorry, I forgot to record.
That's it.
Thank you. But we're back. We're better. We got a new mic. I don't know if you can see the mic in the camera.
Yeah, it's visible. You
Okay.
can see it in the little screen. I don't know if you can see it from your end.
Perfect. I can't.
It's okay.
I'm just blind, but that's fine.
Yeah, it's fine.
But yeah, we're trying to do something new. I mean, we've done recordings on camera before and whatnot, but
This time we have some sort of setup. Oh, big things are also coming. Potentially.
stay tuned.
Stay tuned. We may have funding to have like a proper setup going on, and
Maybe.
maybe not. I don't know. Maybe we might crop this part out if things don't work out. But
We'll see.
we'll see.
Anyways, back to the real reason we're here today.
Mm-hmm.
It's on a special episode. We say that about every single episode, but another special episode.
This is a good episode, even more so than the other episodes.
Like we say every single time.
But it just gets better and better.
Do you want to introduce it?
Sure. So, given the state of the world right now, as if it's not always in constant flux, but perhaps more so now, given, at least in the news and everything going on, there's been a lot of information being shared about refugee health, and how, some of the implications of that, how that's going to affect Canadian society, but also globally. Mm-hmm. How the influx of refugees from different nations all around the world is going to affect different populations, but also particularly on a health level. So, given all of that, we decided, hey, let's talk about refugee health today.
Thank you for that introduction, Sonia.
Thank you.
Thank you. Anyways, before we start diving into refugee health and just kind of various reasons for displacement, the physical challenges, mental health challenges, barriers to access, whatnot. I just want to go through a legal definition of what a refugee is, and this one's based on the 1951 Refugee Convention and its 1967 protocol. So, refugee, I'm just quoting for verbatim, is a person who has been forced to flee their country of origin due to a well-founded fear of persecution, conflict, violence, or other circumstances that have seriously disturbed public order, and who, as a result, is unable or unwilling to return to their country of origin.
Out of curiosity, so Jaanuni being the global health graduate almost at this point, what was the focus on refugee health in your program?
Actually, coincidentally, I realized this yesterday when I was doing research for this and whatnot, so we had a global health symposium.
Yeah.
That was part of our program, where essentially students from not all around the world, but students from the partner universities, which were India, Colombia, the Netherlands, did I miss any? Canada, of course. I think I'm missing one more. I think Thailand. And then we all essentially went to India, or virtually, and we participated in a global health symposium, and the focus, at least in my group, for my project, was refugee health. Mm-hmm. And we looked at, if I'm not mistaken, 2 different countries and just the policies, and we created a systems map based on that.
Gotcha.
Yeah, so that was kind of focus. It also depended, other groups had more environmental health, but there was of the 3 focuses that we had, refugee health was one of them.
Interesting.
Yeah.
Okay.
Yeah. So that was a really cool project, looking at different countries and their different policies and seeing how it was affected in different terms of like the government levels, and like some countries had more of a provincial like predominance, while other ones had more like a federal level predominance for that.
What do you mean?
Like some schools, what am I saying? Some countries, they just had more resources and support for refugee health from like a local impact, right?
Gotcha.
And others more federal.
Okay, so the level of support I see is varies between different...
Yes. Like levels. Or like there's a difference in emphasis based on the countries.
Gotcha.
If that makes sense.
And and the respective levels of government. So whether it be local. Okay, gotcha.
Yeah.
So there's also a number, you sort of talked about this already, but you said that there are a number of reasons for displacement. Mm-hmm. Do you want to talk a little bit about what those reasons could look like?
Yeah, for sure. So obviously there's various reasons for displacement that lead to the refugee status. One being conflict, as we may know, like armed conflicts, civil wars, other forms of political violence that can force people to flee their homes and seek refugee elsewhere. For example, the ongoing conflict in Syria has led to the displacement of millions of people. Mm-hmm. We obviously had persecution, so people may be persecuted for their race, religion, nationality, political opinion, or a membership in a particular social group. This persecution can take many forms, such as torture, imprisonment, other forms of violence. Additionally, there's also natural disasters. So natural disasters such as earthquakes, floods, hurricanes can displace people from their homes and force them to seek refuge elsewhere, of course. And then lastly, we have environmental factors. So climate change, deforestation, and other environmental factors can also lead to displacement. For example, rising sea levels and desertification can make certain areas not livable, which force the individuals to move elsewhere.
Gotcha.
But it's important to note for sure that these reasons are not mutually exclusive, right? So people may be displaced for a combination of these factors. Could be both a combination of political, economic, social, whatnot, because obviously this is displacement is very complex and multifaceted.
Gotcha. I appreciate how you spoke about the environmental component, because I was trying to find stats on this, but wasn't able to in the moment. But environmental, or what am I trying to say? The environmental the implications of climate change on refugees and refugee health, I think that's expected to be like the biggest contributor, or amongst the biggest contributors to causing the refugee crisis in the future. Like right now it's like a leading contributor as well, but its effect is expected to multiply within the next like couple of decades because of how bad climate change is getting.
It is interesting. I wouldn't make that connection.
Thing is, like, the environment and environmental health can correlate to so many issues surrounding, like, perpetuating the refugee crisis. So it's not just climate change necessarily, like, natural disasters happening, it's the ramifications of it, right? So, like, leading to malnutrition and deforestation and people losing their homes and displacement and, like so many other things, right?
No, for sure. I found one stat that says approximately 25 million people across 140 countries were displaced in 2019. So not that recent in retrospect, but it was due to weather-related events. So in 2020, global temperatures reached new records highs, and the year was marked by dozens of fires, floods, and intense storms. So that's just kind of putting things into perspective of, like, in terms of numbers for it.
Yeah, and even, I'm thinking back to an episode that, you weren't a part of this episode. This was an episode that I did for a class, and it had these 2 other students in it, Jack and, I forgot the name of the other guy. But it was on,
Sorry, guy.
Yeah, it was on, the Afghanistan and the water crisis in Afghanistan, and it spoke about how, like, more than 90% of the country didn't have access to running water and clean water. So, like, that's just an example of how, granted, a lot of the main reason why the water access was limited was because of the Taliban and their restriction of different water sources around the country. But that's still an example of how, like, I guess, restricting environmental restricting people's access to the land and creating situations where or creating like environmental degradation
Yeah.
or like man-caused environmental degradation can perpetuate the refugee crisis.
No, I agree. And it's very interesting to see various factors playing a role into this, from, of course, conflict, persecution, natural disasters, and environmental factors. And it's also interesting to see how environmental factors might play a more predominant role in the future. In terms of the displacement, there are both physical and mental health challenges that refugees commonly face. So now we're going to get more into the aspect of the refugee health and those kind of how they're affected by it. Obviously, refugees face a multitude, a range of physical and mental health challenges. Physical health challenges, Sohnia kind of briefly mentioned this, but malnutrition, infectious diseases, lack of access to clean water, limited healthcare resources. As a result, they're at a risk of developing diseases such as diabetes, hypertension, and cardiovascular disease due to changes in lifestyle and diet. Also considering how abrupt these changes might be to their... What's that word? What am I trying to think? Your body?
Yeah.
Your system. To your body. So just to kind of dive into a bit more of the physical challenges that refugees might face, malnutrition being one of them, of course. So they're often experiencing malnutrition due to the lack of access to food, water, and other basic necessities. Obviously, this can lead to a range of health problems, including stunted growth, weakened immune systems, and increased susceptibility to infectious diseases. I mentioned this. So another impact is also infectious diseases. So refugees are at an increased risk of contracting infectious diseases.
Bless you.
Oh, cut that out.
You're good.
So as I mentioned, infectious diseases. Refugees are at a risk of contracting these diseases because of overcrowding, poor sanitation, and limited access to healthcare. Of course, the lack of access to clean water and sanitation can lead to the spread of waterborne diseases such as cholera, and typhoid fever.
Just to add on to that, I feel like even like within Gaza, for example, and like the different areas around the Middle East, like that's just a perfect example of how like issues surrounding refugee health can be magnified, especially during times of like war and genocide and displacement and all those sort of I don't know what the right word is, but challenges.
Yes.
That's probably like an understatement of what's going on, but just how all these issues can be magnified, especially during times of war, which ultimately diminishes the health of, those trying to flee these sort of situations.
I was going to say, it also leads to the next challenge of limited healthcare resources, right? Because these are magnified, it's depleting already what might be considered depleted resources, and that further limits the resources, which include medical supplies, equipment, personnel, right? And obviously, when you have limited healthcare resources, we've seen it in low-income countries, high-income countries. We know when there's a limited resource of healthcare services or equipment or whatnot, it leads to inadequate treatment, injuries and illnesses, and as well as preventative care.
And what's interesting, it's not just on the level of like the refugee camps that people are often placed in during their transition to whatever their new home will be, which can often be years residing in these camps. But it's also when these refugees eventually find home in like wherever, let's say Canada. There's been a number of studies where couple things. So first, in regards to healthcare access, like a lot of my work focused on this before, but immigrants and or newcomers and refugees, as they are settling into their new home, their ability to access healthcare services, whether it be because of language barriers or not knowing where to seek out these sources, it's significantly diminished. Like, even though within the area everyone has quote unquote access to these resources, like that, it's it's not true, because there are these barriers that newcomers and immigrants and refugees face in their ability to access these resources, if that makes sense.
No, I agree. I was like, there's a word for it. Like, there may be access to the healthcare services, but is there...
Like their utilization
Yes,
of the
utilization.
services?
Yeah, that's what it is. And I think that's where the discrepancy is. There might be services in the community, right? But individuals, like you said, they might not know of it. There might be language barriers. The system is different from your home country of how to go about it, cost, whatnot. There's so many barriers to that when going to a host community or host country for that.
I had another comment. Oh my goodness. What were you saying before? It was not just about the access to these services. It was
like limited healthcare resources, or the utilization of such.
Oh goodness, I forgot my point. Never mind. If it's important, it'll come back.
No worries. Okay. So we touched upon the physical health challenges. Do you want to kind of dive into potential mental health challenges? Obviously, we know when you're going from a sudden change, it definitely has an impact, not only physically, but mentally.
Yeah. So that's exactly it. Like there's so many, specifically from a mental health standpoint, this is an area that's often under-researched and under-promoted, specifically because of not just specifically, but because of a number of issues like stigma surrounding mental health, and maybe it not being as prioritized as addressing like urgent care needs. But I'd argue like even mental health can be considered an urgent care need, especially if you're experiencing a state of psychosis or anything like that. But displacement, as you kind of touched upon already, the displacement experience that refugees face can cause significant trauma and stress, leading to a range of mental health challenges, such as post-traumatic stress disorder, commonly known as PTSD, major depressive disorder, generalized anxiety, and panic attacks, which are all sort of comorbidities with each other. It's not like these happen in isolation, they can happen all together. And refugees may also experience feelings of isolation, loneliness, and hopelessness due to the uncertainty of their situation and the loss of their homes and communities. And these situations, not to say it's magnified for certain groups, but I can only imagine that it would potentially be magnified for those that are traveling with their families and trying to ensure the health of their young ones and their kids, and the vulnerable populations that they may be experiencing displacement with. But it's also important to note that refugees often face additional barriers to accessing healthcare. So, as we already talked about, but because of these language barriers and cultural differences, institutional discrimination and restricted use of health services, this could all magnify the issues surrounding mental health challenges that aren't just happening on an isolated basis, but for chronically on a long-term basis.
I was just going to jump in and kind of put into perspective of, like, in terms of numbers of these mental health issues. So there's a meta-analysis of 193 studies that were conducted by the UNHCR, which found that 30% of refugees experience depression and anxiety, while up to 40% experience PTSD. But these rates actually might be underreported due to the challenges that they face in accessing mental health services and resources. So this number is just what's been reported, but this could very much be underreported.
And real quick, you mentioned the word meta-analyses. Do you want to maybe explain what that is?
That's a great question.
Or I can also comment on it too.
Say, how do I say
so,
in a layman terms? I was like,
as a research methodologist, sometimes terms like systematic review, meta-analyses, whatever, they can be conflated as the same, but they're like different and important to distinguish. But basically, anytime you hear the word meta-analyses, it essentially, so within the health research methodology world and evidence-based medicine world, we have this hierarchy of evidence. At the very bottom, you have anecdotal research, or not even research, like anecdotal commentary, and then it slowly moves up from doing observational studies to RCTs and sort of a consolidation of all the evidence that exists. So when you hear a meta-analysis being done, that essentially means that current evidence existing on the topic is consolidated. Researchers, generate a research question, and they do a database literature search, and they find all these articles that are talking about this specific topic, and then they dissect it. They look at specific outcomes. They perform things called a risk of bias assessment, where they see if the research being done is has a certain level of error presented in it or a certain level of uncertainty, which could minimize the results. But overall, when you see a meta-analysis being done that's indicative of a high level of evidence synthesis being done, granted, meta-analyses can be improperly done and not robust, and that could lead to inaccurate reporting of findings and the synthesis of evidence. But yeah, just to say that a meta-analysis is a synthesis of evidence, and not to get too much into the details of it, but it's important that meta-analyses are done.
So basically, it's essentially a collection of all the current research studies, or whatever is eligible to be part of it, and summarizing those findings based on their research question.
That was a little segment on research methods. Perhaps can you talk about maybe the prevalence of different health challenges?
Yeah, for sure. So, refugees and migrants have...
Oh, sorry, no, I remember what I was going to say before. Continue, though. I'll say my point after.
Yes. Refugees and migrants have a variety of different physical and mental health needs, shaped by experiences in their country of origin, their migration journey, their host country's entry, integration policies, living and working conditions. What one refugee might be experiencing in one country is not the same as another individual. It is very individualized, I would say. According to the World Health Organization, the major causes of morbidity and mortality among refugees are measles, diarrheal diseases.
Like cholera?
Yes. Acute respiratory infections, malaria, malnutrition. These diseases consistently account for between 60 and 80% of all reported causes of death. That's a lot.
Yeah, parasitic diseases are rampant in areas where sanitation is really, really poor, and that's often what you find in refugee camps or in areas that don't have access to electricity and running water and, I guess, sanitation, as I already said. But yeah, that makes complete sense. Yeah, but it's also devastating because they're preventable diseases.
For sure, and it almost puts my perspective on my life and what I'm fortunate for, like something as simple as running water and whatnot. No, okay. Just to continue with that, so malnutrition is both the primary and secondary cause of death. I know I mentioned the diseases as 60 to 80% of causes of death, but malnutrition is both the primary and secondary. The World Health Organization also reports that refugees and migrants often face worse health outcomes in countries of transit and destination due to barriers including language and cultural differences. So you mentioned this before, and restricted use of health services. But I also wanted to touch upon how social, political, and economic exclusion can result in poverty, homelessness, and exploitation, which can actually create a higher risk for these diseases.
Yeah, it stems back to some of the comments about like institutional racism, and or not even just in this podcast, but we've had before that spoke about how institutional racism and discrimination and prejudice and all these sort of factors can compound to affect an individual's access to healthcare and their overall health. But sorry, did you have more to say on that?
No.
Okay.
Sorry.
I'm sorry. I didn't know if I cut you off.
Yeah. You were going to mention something earlier.
Yeah, so the comment that I want to make before is, so going back to, how do I even frame this? So, even when, so you spoke about that transition state where refugees are in whatever, wherever they are, they end up in this transition country where they're waiting to see if they can go to, wherever they actually want to end up. Well, actually is probably not the best term, but I guess their new destination, their new home, if you want
a host country.
Host country, perfect, thank you. Even when refugees are able to make it to their host country and sort of acclimate into whatever setting that they're in, there's so many barriers, like we spoke about before, even beyond, or because of the healthcare access, because of, racial discrimination and institutional racism and all these sort of stuff that affect their overall health outcomes. And there's this phenomenon called the healthy immigrant effect. It applies to immigrants and newcomers and refugees in different populations, and it shows that. So oftentimes when refugees can be a little bit of an interesting situation, but oftentimes when people from different countries around the world, they come to Canada, and when they initially come to Canada, there are certain anthropometric measures, meaning I guess like biomarkers.
Yeah.
When they come to Canada, they're relatively good. Like their A1C levels, like their blood sugar, blood pressure, obviously it can vary, hypertension, all these sort of things can vary, but their overall measures are better compared to the average Canadian population.
Oh,
but
okay.
it's interesting though. Again, refugees can be sort of like an interesting situation.
Yeah.
Like different like cardiorespiratory health, like certain things typically are better amongst these populations.
Okay.
But over time, research has shown that immigrants, refugees, and newcomers, their health status begins to deteriorate.
Okay.
And this is because, going back to the issue of healthcare access, issues navigating the new healthcare system, all this sort of stuff.
Yeah.
They're both mental health and physical health status.
Yeah.
Even though they're coming from these situations that are certainly unideal.
Yeah.
Like their health status begins to deteriorate. So not to say that they're coming in a great place to begin with,
yeah,
but it becomes exacerbated because of different institutional issues that prevent people from accessing the health care that they need.
I was gonna share a story of, so I used to go to this eyebrow lady, and she was a Ukrainian refugee, right? And I remember just going there and kind of, I was excited. I was like, okay, like, even amongst our conversations, she was sharing how obviously there's family left behind. Her and her husband was able to come here, whatnot. She was able to bring her cat, etc., etc. But it was very interesting for her to ask me questions that I thought was like, oh, like, what do you mean? Like, how to go to a doctor? What do you mean? Like, how do I get medication for such? What do you mean, like, applying to university and stuff like that, right? But I didn't realize that they don't really have some sort of means or like an individual to like go and ask. It's kind of like figure it out on your own, and there's also a struggle with that. Even though she's been there for a couple of months, she was asking questions about like something as simple, like obviously in Canada, like what kind of boots to buy, like how cold does it get, and just something as basic as that to us that might come innately, intuitively to us, might not be for someone that comes to a different country. And I'm thinking of my, like, obviously not in the perspective of a refugee or an immigrant at all, coming from a very privileged perspective of going to a different country in terms of exchange. I struggle with navigating that. It's not the same because in no means was I fleeing from anything. But there's always that barrier of overcoming and navigating new systems, especially since there's no such thing as universal healthcare. There's no such thing as how to navigate XYZ.
Yeah. And I guess the whole point of, thank you for sharing that, the whole point in sharing this, or the sentiment about the healthy immigrant effect, it's essentially saying that it doesn't get easier. Like, even after, like, you're able to flee these horrid situations, like you were saying, like, being able to find these resources just because you're in an environment that, quote-unquote, says that they offer free healthcare service and blah, blah, blah.
Yeah.
It don't mean much.
Yeah.
Man, you can't, like, people coming into the country, like, going back to, when I was, working and doing recruitment and stuff like that with the previous project that I was on, like, there's so many people would be like, oh, like, how do I find a doctor? How do I find my own primary healthcare provider? There's nobody in Canada. Well, not that there's nobody, but there's so few people in Canada.
Yeah.
It's horrible.
Yeah. Even as an individual, like, Canadian-born, Canadian-raised, whatnot, to find a family doctor, like, just doctors, like, just, I guess, this could be a whole different topic, but the healthcare system currently in place is already a struggle for me. Imagine for an individual that has language barriers, cultural differences, whatnot.
Yeah, people that are fleeing these horrible situations that just want to find some sort of solace and support, and then you're like, JK, we actually don't have that for you right now, but try again in like 2 years.
Yeah, and it's like, okay, great.
Maybe.
Yeah. But that's to say, like, of course the government does provide certain support in certain areas. I think it's also important to note the roles played by organizations like the United Nations High Commissioner for Refugees, the World Health Organization, and various non-governmental organizations in addressing the health needs of refugees. Of course, international organizations, I almost sound French for a second there, and NGOs play a crucial role in addressing these needs. Just give me an example of kind of what the different organizations do. The UNHCR is responsible for providing protection and assistance to refugees, including access to healthcare services. Also, feel free to jump in and add anything. The World Health Organization is responsible for providing technical assistance and guidance to countries on refugee health issues. NGOs also play an important role in providing healthcare services to refugees, particularly in areas where the government services are inadequate or non-existent.
Gotcha. From just to tie in everything that we've mentioned today, it's clear that there's a lot of different stakeholders involved in understanding refugee health, but also addressing its ramifications, not just from the level of different organizations and NGOs, but also on a governmental level, societal level, but then also from the perspective of host countries and host communities. So, just as a summary statement, it is important to recognize that refugee health, or the refugee health crisis, is a global issue, even though sometimes it feels like it's happening on sort of like a microcosm. It affects everybody. And this issue requires a coordinated response, like we were saying, from governments, international organizations, NGOs, and so on. These efforts can help ensure that refugees have access to healthcare services they need and also have the right to access. And that the host communities are not overwhelmed by the influx of refugees that are going and navigating the systems in their area.
No, I completely agree. I think that was a really good way to end off this episode.
Slay.
Work together, as much as it sounds.
Kumbaya, my lord.
Yeah.
Kumbaya. That sounds so like
yeah,
just diminishing the entire issue. Just give someone a hug. No.
This is why we can't be politicians.
No, man.
No.
Anyways, well, thanks for joining today's episode.
As always, this is a pleasure.
See you next time. Big things are coming.
Bye.
I'm not going to ASMR into the mic. Okay.